now the next we will study about the treatment modalities for squamous cell carcinoma, which is number one. We will do study about the surgery, why we do surgery, radio and chemo and laser and immunotherapy, and then gene therapy, and only surgery and radiotherapy are curative. The objectives of the cancer surgery, Bismillahirrahmanirrahim, to excise the entire neoplastic tissue, the tissue which is basically neoplastic, or the changes has been occur in that particular area and that tissue. So you will remove the entire neoplastic lesion. Then the next is to remove in adequate margins of adjacent normal tissue. You have to remove the also the normal adjacent tissue to ensure that properly you have removed that neoplastic lesion in a anticipation of the microscopic spread, that it shouldn't spread to the small areas. So you have to also remove the adjacent normal tissue. Then remove and all the necessary potential channels of metastasis. You have to remove all the possible channels through which it can spread. Either it can be lymph nodes, it can be nerves. You have to remove it. Now, also to promote healing and rapid restoration of function, that place or that tissue should heal rapidly and restore its functions rapidly. Surgical modalities are of different types. Number one, we have definitive surgery, in which you can study primary and secondary. Palliative surgery, you actually basically do not remove the cause, but you just heal, or you have improved the symptoms. And debulking surgery for metastatic diseases, those diseases which has been spread, or emergency oncological surgery or reconstructive surgery you do for that. Okay, so now repeat it with that you have to remove the excise the neoplastic lesion, or you have to remove the adjacent normal tissue in order to anticipation of microscopic spread, and also to remove all the necessary potential channels through which it can spread, to because you have to you need rapid healing and rapid restoration of function. There are different surgical modalities like definitive debulking, palliative surgery, surgery for metastatic diseases, and oncological surgery and reconstructive surgery. Then why you do radiotherapy? Radiotherapy is run for all two primary tumors, and also reduce the bulk of tumors. Those tumors which are very invasive, you actually reduce the bulk of that. Those which are basically fixed to the surrounding structures or underlying structures, like it happens in the intermediate lesions. Okay, then also to decrease the incidence of local recurrence. One of the thing is that we do also radiotherapy and that lesion, because we want to ensure that that lesion shouldn't occur again. Very important. Then eliminate the positive tumor margins following incomplete resection. Also give proper margins you can. So to reduce the debulking, reoccurrence, and also those that are underlying fix. Reduce the incidence of nick recurrence after surgery if more than one lymph nodes are involved, or extra capsular spread. Also, to when nick is involved, so there are many chances of recurrence, so you have to also do that surgery. Then you have external beam. Okay, then you have superficial, then you have ortho voltage. There are different beams: mega voltage, electron therapy, surface applicator, and interstitial implantation. Chemotherapy, which is very that is given in the advanced lesion. Okay, it eliminates the clonogenic cell completely. It is given in stage 3 and 4. Basically it can be in a combined therapy in number of variations listed. Either you give in single chemotherapy, combination therapy, induction therapy. Like it is in combined, then it is actually in single, but in induction, sandwich, adjuvant, and concurrent chemotherapy, and palliative care. Okay, chemotherapy is basically anti-metabolites and chelating agents you give to the patients. So it basically neutralize those metabolites, work against them, or mitotic inhibitors you will give. We will study it. Then in anti-metabolites we have some drugs. Which drugs are very important? Which drugs are present in antimetabolites? Methotrexate, anti-cancer drug, and 5-fluorouracil is also anti-cancer drug. Alkylating agents are cisplatin, which is an element, bleomycin, which we also studied for leukoplegia. Cyclophosphamide is anti-cancer drug, and also adrenomycin we also give to the patient. Okay.